Ok, pues estamos aquí en nuestro primer podcast. Bienvenido a Conversaciones con el Dragón. El día de hoy tenemos a una invitada. Today we have a very special guest. Vamos a estar abordando. We're going to be talking in English, but this is a podcast originally made for a Spanish-speaking audience. But because of our guest today, we're going to be managing this podcast. We're going to be directing this podcast in English. So it is Conversations with the Dragon, Conversaciones con el Dragón, where we're going to be talking about the up-to-date on the most current knowledge regarding emotional intelligence. We're going to go deep into understanding insightful knowledge regarding psychology, human behavior, lots of juicy stuff that is really relevant to today's age. Well, it's always been incredibly relevant, but I think more people are paying it attention now more than ever, considering how much of an emotional crisis the world is in. And, well, yeah, so today we're going to be with Lisa Terni Dion. Lisa Terni Dion, she has an amazing background. We're going to be talking about it all. Psychotherapist, founder, co-founder of the Synergetic Education Institute, president of the Synergetic Play Therapy Institute, and Master Facilitator in the Demartini Method, which I met her in the Demartini Institute when I was just 14. I'm 27 now. And what else? What other credentials do you have going on around here that we're not mentioning?
Well, since we're talking about therapy,
Yeah.
I'm also a certified Gestalt therapist.
Certified Gestalt therapist.
I'm also a EMDR, which is eye movement desensitization reprocessing, which is a trauma protocol. I'm a practitioner of EMDR. I'm also the creator of Synergetic Play Therapy, which is a model of how to work therapeutically with kids. And
we're gonna have to go deep into that because how can you give therapy to a kid when the kid is not, he can't dialogue with you back, right? Mm-hmm. You were saying, sorry.
Yes, exactly. But outside of those types of credentials, I have a pretty extensive background in mindfulness practices.
Yep.
The somatic therapies, which I know we'll talk about today. So somatic, for people that don't know the word somatic means, it's about the body. Mm-hmm. Because there's different ways of approaching therapy. There's ones that are just cognitive, mm-hmm. mind-based. There's ones that are body-based. I'm going to talk about the importance of both. Probably if there's a therapy out there, I've probably tried it. Yeah. Just in my own journey of trying to make sense of the world of therapy.
Amazing. And that's great that you talk about the body and the mind, mm-hmm. because in reality, I think that it's important to bring into this new paradigm that there's no such thing as the body without the mind, and there's no such thing as the mind without the body. It's more like the mind-body. Mm-hmm. And we're going to go deeper into that. Before we go into everything that you know and what you think right now is of the most insightful and relevant information that you think our audience should know coming from you, I want to talk a little bit about your background, because in order for people to understand how special what you know is and how special you are, and I know you probably just you don't want to see yourself as like this grand thing, right? But for me, knowing you since I was 14 and being very privileged to get to know you, I do consider you a very special person, particularly in my life and how you have helped me and participated on my journey. Tell me a little bit about your background. Tell me a little bit about your grandfather. Tell me a little bit about your grandmother. Where in order for you guys to understand Lisa Terni Dion and what she knows and how insightful her criteria is, because more than knowledge, it's how you filter that knowledge, mm-hmm. and the criteria with which you have that permits you to understand deeper. Mm-hmm. Tell me a little bit about your family lineage.
Yeah. So in some ways, I feel like there was a funnel on top of my head where, you know, it was like if someone were to look in my history and just follow the funnel, they'd say, oh yeah, that's what Lisa's going to do, you know, when she grows up. So
I feel the same way, by the way. I feel the same way.
So my grandfather was a psychiatrist, but he had a focus on Freudian psychoanalysis, and he's from Germany, and he came over to the United States and was the first psychiatrist at the very famous Mayo Clinic in the United States. And he ended up marrying a woman who was my step-grandmother, who was also a psychiatrist. But what was really special about her is that she was a very spiritual woman. And she started to weave in the idea of spirituality into psychiatry, which at the time was unheard of.
And this was around what time?
Well, she was doing this before I met her. I met her when I was 1 year old. So when I was born...
This is 19...
I was born in 1977.
Okay.
Thank you for aging me on this
No,
podcast.
but she was... I'm sorry.
That's great.
No, I'm saying, for her, it was 19... She was doing this around 19...
So she became a psychiatrist. I'd have to... Let me just take a guess here, but... probably in her late 30s, early 40s, which that just wasn't heard of, at the time. And so I'll get into my mother in a minute, but just with those two, I felt like I was thrown into conversation about the world of therapy from like a very, very early age, listening to my grandfather tell stories where literally his patients would come to the house and he'd have them lie on the couch and he'd turn around in his chair and he had the pipe and he'd smoke the pipe and he would take the notes. And actually he passed away in his 90s and he still had clients coming to the house. He'd call them patients. He still had patients coming to the house that would lie on the couch. He didn't smoke his pipe anymore, but he would just have them free associate and he would do psychoanalysis with them.
Wow.
So he did that. He was probably doing that a week before he, passed away.
Wow.
So
May he rest in peace.
May he rest in peace. Yeah. So I grew up listening to these interesting stories around that, and then with my grandmother, listening to her weaving in spirituality and how spirituality as a place in the world of therapy and in the world of helping. It was just very interesting.
And just to make a little interruption here, your grandfather was among the first Freudian psychiatrists. He was the first
in the States.
In the States, in the Mayo Clinic.
In the Mayo Clinic.
Yeah.
Yep, exactly.
And for those of the audience that do not know, the Mayo Clinic is amongst the most renowned clinics in psychiatry and psychological help in the United States.
Yes, exactly. And then what was interesting there is she was approaching spirituality from different places. Part of it was from a religious background, but then she also had a part of her that was very into metaphysics. And so I had very interesting conversations with her about how religion and then metaphysics also play into psychology.
Right.
So
which is a very it's a bold statement.
A bold statement.
Very bold statement at that time.
She was a woman.
She was
a woman. So we'll weave that together. So all of that I listened to growing up before I even decided that I wanted to be a therapist and before my mother became a therapist. So my mother became a therapist when I was 11 years old.
Okay.
And my mother, in her studies, she was really focused on helping individuals that either were struggling with addictions or were struggling with what we would call personality splits, schizophrenia, dissociative identity disorder. The stuff in the world of therapy where people go, whoa, that's the really, really...
Yeah, that's the trenches.
That's the trenches. That's the big stuff. Eating disorders, but significant levels of eating disorders. So my mom was really fascinated with all of that. So growing up, I remember, again, stories. I remember, well, so
Morbid stories.
well, so this is another story that dates me, but you know, we had answering machines where people would call and they would leave a message in the answering machine, but it would play throughout the house, right? You could hear the message,
Wow.
right? And I remember,
And these were her clients.
well, there was a client that called, and I heard the message play throughout the house, but I remember the nature of the conversation that she left was just very interesting. And so I had said, like, Mom, who is this individual? Because she referenced her name as this, but like 30 seconds later, she referenced her name as this. It was like multiple people were leaving a message. And she
From the same person.
And she said, oh, let me show you something. And she pulled out, so in the world of therapy, we call this a genogram. And a genogram is where what you would use in a visual representation to track family patterns. And so, the funnel.
Yeah,
so
yeah.
you can really look at the different family influences. So she pulled this thing out, and I went, oh, that's so cool. Is that her history? And she said, no, that's her. I said, what do you mean that's her? She said, I've had to map out her inner world.
Wow.
I've had to map out all of her different personas that live inside of her. She has 52.
Wow.
Right?
And
So
you're 11 years old when you see this.
I was probably more like 13, 14 at that time.
Okay.
But just to give a sense of, I'm being exposed.
You're being exposed.
Being
And the thing,
exposed.
something that is really important, I think the audience should know, and I can say it also from personal experience. When you're born into that space, you don't know that there is a normal reality. Like, you don't know that people are not accustomed to experiencing the psyche like that. And because when I met Dr. John F. Demartini when I was 13. So when I learned the Demartini Method when I was 14, I didn't know.
You didn't know that
I
that
didn't-
wasn't common thought.
I would, exactly.
Yeah, exactly.
Tell me a little bit about that. How did that, because that built your criteria. That built the way that you filtered reality and understood reality.
It did.
Understood human behavior. I can imagine that at 14, 15, 16, 17, you probably didn't fit in. I mean, it was
No.
very hard for you, right?
Well, on top of that, my mother is handing me books to read on, we'll call them the greats.
Okay.
You know, so she's throwing me, everything from Emerson to Henry David Thoreau to different books on spirituality. My mom also was really into Native American spirituality as well.
Amazing.
So my
That's
mom,
beautiful.
yeah. So my mom's also bringing in this whole other cultural component to understanding.
But
People.
your mother was also, I mean, your grandmother, or your mother was also a psychoanalysis?
She was a psychotherapist.
Okay, psychotherapist.
Yes.
And her approach was what type of therapy?
She was more like humanistic.
Okay.
So she was more just like a more of a relational approach. And this might be actually an interesting piece of education because sometimes all the words are confusing. So a psychiatrist is someone that prescribes medications. Not that they don't do the talk therapy, but they subscribe.
Yeah.
A psychologist is someone that does testing in addition to. And then there is a psychotherapist that focuses primarily just on facilitating this kind of a process.
Yes. The
So
therapy.
The therapy process.
The
Exactly.
therapeutical
So I'm-
rehabilitation type approach.
It's helping them integrate traumas and work through and make
And I say
meaning of their life
rehabilitation
and-
because it's also, some people consider it an illusion to think of it that there's anything broken with you or rehab, because there's like there's a different lineage, there's these different currents where like, well, you could see it in Carl Rogers as opposed to like
Yes.
Freudians, right? Where it's like psychoanalysis has this clinical paradigm
Yes.
where you're considered in some way or another having to go through a rehabilitation. There's something broken that needs to rehabilitate, and that's why they call them patients, right? And then there's another component where the human potential movement that talks more about their clients. They have a potential, and I assume that there was such a beautiful mix from your grandfather, who was a psychoanalyst
and prescribing medication.
and prescribing medication, and your grandmother, who was more on a humanistic approach.
But still prescribing medication.
Still prescribing medication?
Yes,
Okay, amazing,
exactly.
amazing.
And then my mother...
So she was also a psychiatrist?
She was also a psychiatrist,
Okay,
exactly.
okay.
Yes.
And then your mother was a psychotherapist.
She was a psychotherapist.
Humanistic psychotherapist.
Yes.
And you were born into that space, and you're growing into it. How did that influence you, and what were you curious about? What did you want to understand? Because that's just, you had answers on top of answers on top of answers that normally people don't have. What questions were you questioning?
So human behavior for me was just fascinating since I can remember. And just psychology was fascinating to me. Mm-hmm. The deep questions were fascinating to me. The big spiritual questions were fascinating to me. I think all of that was because of all of what we're talking about. Other things also, my own life experiences. But having said that, I still didn't think I wanted to be a therapist.
Okay.
I was on the road to law school.
Okay.
And I could not, for the life of me, get through the final hurdle to actually sign up to go to law school. But even my first degree was in political science, so that I could head to law school.
Didn't know we had that in common too.
Exactly.
Yeah.
And then
I did receive my law degree. But
you did.
But it's very different.
Yeah.
In law in the United States than it is in Mexico. But yeah.
So it wasn't until I had my quote-unquote dream job at a law firm for an internship when I realized I hate this. But I was completely fascinated by the relationships that were happening in the office. And then it clicked for me, why don't I just be honest with myself that I absolutely love human behavior and relationship and psychology, and that's really where my heart is. So I actually pivoted, changed my schooling, immersed myself into that world, and then went on and got my higher degrees. And so my actual degree is in what's called transpersonal counseling psychology, which is the study of, even just you can hear it in the word, right? It's all the factors, all the influences that affect an individual, from their social, their spiritual, their mental, so that's how I got there. Mm-hmm. That whole I finally
transpersonal
counseling psychology is my degree.
Okay.
Yes. I studied at a very contemplative school. So this was also a beautiful thing that's a little different in the United States. So the school that I went to was actually founded by a Buddhist monk.
Okay.
Although you didn't have to be Buddhist to go to the school. It
Right.
wasn't a religious school per se.
Yeah, not something that a Buddhist monk would do.
Right. So, but it was a contemplative education. So what did that mean? So in addition to our typical counseling classes, I was also required to take classes like Tai Chi.
Amazing.
And meditation. And yoga.
That connected you with the body.
Exactly. And
so that's where the mind-body discovery and the whole, I think that was the birth of synergetic play therapy. I mean, it was the seed, right? It was like...
It helped me understand that if I'm going to be with another human being, that there needs to be just as much emphasis on what's happening inside of me as what's going on inside of my client. And that was a piece that was, and I would still say is very missing at large in mental health field and in mental health training. And since I know that this
simply because of the, sorry for interrupting, simply because of the phenomenon of the law of reflection and transparency by Carl Jung, where everything is a projection and everything is a reflection of you. So the therapist is projecting his stuff onto the client. And so if the therapist is not completely aware of that and understanding how to regulate his nervous system, which is what I learned from you, then there can be some blind spots. Yep.
And that's one of the biggest pieces that I try to go after in the field. Because what you just said, by the way, is not common thought.
Right.
It's considered a no-no for the therapist to bring their stuff into the space without...
But there's nothing that they can do to not bring it.
Well, that's the whole point, is that it's actually an illusion that it's even somehow possible for them not. So I want to bridge this out a little bit
Yeah.
to relationship, just for listeners, because I think this gets super interesting when we're talking about emotional intelligence.
Yeah, because we need to make it relevant for
Yeah.
this.
Well, so like right now, right? So
Yeah.
you and I having a conversation, whether I was the therapist and you were my client, whether I was your mother and you were my son, whether we were partners, whatever it is, we were working. Okay, so we've arrived into a moment, right? So here's this moment. You are bringing your entire history to this moment. I am bringing my entire history to this moment. There's no way you cannot. There's no way I cannot. And every single thing that you are perceiving, you are filtering through your entire historical construct. So the only way you can experience me is actually through your own constructs and through your own history. Right? And the same thing, I'm having the same experience over here. So as I'm experiencing you, as I'm experiencing this moment, it's all being filtered through my history.
Yep.
So it's this interesting moment of I can't know you without filtering you through me.
Mm-hmm.
And so what do we do with that in relationship? That's a really interesting emotional intelligence question, because it starts to open up the question, well, where do you begin and where do I begin? Or where do I stop and you start?
Where do I stop filtering you and actually getting to know you?
And is
Right.
that possible?
And is that possible?
That's a really interesting question.
Mhm.
But there's a lot of I see fascination with this. Oh, this is just mine. This is just mine. That's yours. This is just mine. It is impossible for something to be just mine. It is impossible for something to be just yours, because we'll call it a resonance. There's a resonance that's happening. So let me break that down even more. So as we're sitting here, we're both picking up on all kinds of nonverbal cues. There's so much happening right now between us that's not even in our conscious awareness. And we're filtering it
Through our nervous system.
through our nervous system, through our senses, all of it, right? And we're both having shifts in our bodies as we're adjusting to whatever it is that we are experiencing. If I am not aware of those shifts inside of me, or I don't heighten my awareness of my responses, my reactions, my movements, why did my tummy just do this? Or why did my voice just do that? Or why is my hand doing that right now? Or whatever it is, I'm not going to be able to hold a space that allows me to hold me and you simultaneously. And I'm going to get swept up in an experience where I think it's all about me, or I think it's all about you, versus recognizing that there are energetic fields between us. Those are research measured.
And that's what is all about. I mean, that's what therapy is all about. It's about bringing what is not aware, bringing the unconscious to the conscious. And if the psychotherapist is not aware of these things, then he's projecting it into the space, and now he's also he's practically, in layman terms, not completely doing his job.
Well, he's not, or she, however, are not going to be able to hold a center.
Yep.
So think of it this
Better
way.
said, it's not being.
If I'm the therapist and you're the client, and I'm not aware of what we just talked about here, well, as you're sharing stories, there's an interesting thing that happens in the brain. When a person shares a story, the listener automatically imagines themselves in the story. Well, the brain can't tell the difference between real and imagined. So let's break this down. So you're telling me a story about something that happened to you that you perceived as really challenging. Okay? Well, as you're telling that, your body's going to shift, your nonverbals are going to shift, your inflections are going to shift, all those kinds of things, and I'm going to feel it. So not only am I feeling it, but I'm imagining being in your story. So I'm actually reliving your experience with you, whether I want to or not. Now, if your story has a trauma component, I am literally reliving as if it's happening to me. So if I am not able to be with myself, if I'm not able to track what's happening in me, and by the way, this doesn't mean staying calm, this means staying connected to myself
And regulating it.
and regulating, what's going to happen is I am going to feel the waves of the trauma, we'll call it,
Yep.
and I'm going to feel swept up in it with you.
Yep.
In order for you to integrate whatever it is that you are working through, I have to hold something in me that allows the waves to come, but in a way where you feel safe enough to have the waves come back into you so they can integrate and ground back in you.
Yeah, and that's also the main question that people ask therapists. It's like, how can you deal with the baggage of your clients, you know? And it's all about, because I bring into awareness how my body is being regulated.
Exactly.
Right, and I think that's something that an amazing therapist will do. He will know how to regulate his nervous system through bringing into awareness everything that he is feeling. And I want to pivot from that a little bit in the conversation and talk a little bit more about that, regulating your nervous system and understanding that in the synergetic playroom, because you wrote a book, very relevant book for mothers, for teachers, actually for anybody, but specifically people that want to deal with children. It's called Aggression in Synergetic Playroom, or
Aggression and Play Therapy.
Aggression in Play Therapy.
Yeah.
And it's fascinating to me when I learned it, because you're teaching me how to practically give therapy to to children when they can't understand their dialogue. There's no mental, you know, that's in the paradigm that the mind body is not connected, and then it's just mental dialect, that you can't talk to a child and be like, hey, like, think about this and tell me about that, and what about this? You start regulating their nervous system through bringing into awareness that feeling. Tell me a little bit about that. Tell me a little bit about how that works.
Yeah. So I'll bridge this. So it became very apparent to me, even when I first started studying play therapy. So the different modalities that I was studying and play therapy modalities, that there was a missing piece. It's the piece we're talking about right now. So it really is one thing to facilitate someone out here. It's another thing to be in it with them in a way where you are incredibly useful in the journey. And so the idea of I'm going to lend another person part of my nervous system so they can borrow it, so they can then move towards the intensity that they're experiencing inside, is a really important construct.
While feeling safe doing it.
While feeling safe doing it. So a child comes into the playroom, and by the way, I feel like I say this, when children play, it's not frivolous. There's no such thing as frivolous play. Play always has meaning for children. It's their communication. So when a child is coming into the playroom and they're communicating, which is what they do, but they're using non-verbally and through the toys and the play and all of this kind of thing. What they're doing in a sense is they're bringing to life what it feels like to be them, right? They're bringing to life what it feels like to be them. They're bringing to life their perceptions of themselves. They're bringing to life their perceptions of what happened to them, the perceptions of in their environment, you know, all of that, right? So they're bringing that to life. Well, as they bring that to life, the therapist is going to feel it, whether they want to or not. Same thing. The parent is going to feel it whether they want to or not. The teacher is going to feel it whether they want to or not. When the child's throwing the temper tantrum, when the child is pacing back and forth and whatever, the child is putting their sister down or whatever, the adult is going to feel it. When the adult or the therapist in this case dismisses that, right, and they go, oh, that's not just my stuff, or oh, that's just about the child, they're missing the magic, right? Because the magic is the child is offering them an opportunity to feel what it feels like to be them.
To be them.
And so if you dismiss it, you're actually dismissing the most important information in the equation.
And actually, that's what you're communicating.
Exactly.
And you're communicating, hey, just repress it.
Exactly. And we all want to be known, right? So the child's going to do whatever they can do to help us, right? To help us know them, right? Ultimately. And so if the therapist or the parent or the teacher can take a moment and take a breath and feel into their body and ask a really important question, what's the setup?
What's the setup?
What's the setup?
Yeah.
What's the offering? What am I being offered to experience right now in this moment?
Yeah, for me, it changed my life. It changed my whole perspective.
Yeah.
It changed my whole perspective when I asked myself, in absolutely any negotiation,
Yes.
in any relationship,
Yeah.
in any circumstance in which I find myself not being where I want to be in relationship to another individual, I ask myself that question. And I mean, sometimes I remember you, sometimes I don't, but I do ask myself, what's the setup?
Yeah.
Because we're feeling what in relationship to that person, especially that child, we're experiencing what it feels like to be them.
Exactly.
And that's the setup.
Exactly. And I love that you just bridge that, because it's not just kids.
It's not just kids.
We're doing this all day
We're
long.
doing this all the time.
all day long to people. The
Yeah.
person's at the grocery store next to you in line that's yelling.
And that's so important in terms of empathetic communication.
Exactly.
I mean, there's a very big difference between sympathy and empathy, obviously, because sympathy is to feel what that person feels, and empathy is to see what that person sees. But when we have the ability to actually feel what that person feels and see what that person sees, we understand their setup. And
Exactly. And from that place, I now get to become curious. And curiosity is a really important component of emotional intelligence.
it's because you can't be mad
Right.
if you're curious. It's very difficult for you to be angry with somebody when you have the curiosity to be like, what's the reason
Yeah.
behind them behaving like that? And curiosity always opens the door to actually getting to know someone beyond your limiting conclusions.
Exactly. It pulls you out of rigidity into possibility. And if something's going to move or shift, you need possibility, not rigidity.
And that opens the door for collaboration.
Exactly.
That opens the door for mutual complementation.
Yep.
That opens the door for conflict resolution, truth telling, communicating with greater levels of just creativity and honesty.
Yep.
And that also expands the potential harmony of the dynamic.
Absolutely.
And that's really relevant in today's world, where there's so much hostility going around everywhere, right? There's so much hostility. And so the question here is, what's the setup?
What's the setup? What am I being offered to feel? People take it so personally versus, hold on, it's just information. That's it. It's just information. And then I want to add in another little piece here, Sebastian. So when I become aware, or I have a moment of curiosity of, oh wow, there's this deep sadness that just came up in me. Oh, I wonder if that's how Sebastian's feeling. Or, oh, I'm feeling like so controlled right now. Oh, I wonder if Sebastian's feeling controlled, or what that's about for Sebastian. Or, oh my gosh, I'm feeling so overwhelmed. Oh, I wonder what that's about for Sebastian. Or, right, like, it's just that place of curiosity. It allows us also to be in the moment. It pulls us out of our, pulls us out of the past, pulls us out of
Inner
the future.
dialogue, yeah.
Brings us into the moment. And then real emotional intelligence. What does the moment want me to do now? I love that, right? And I tell this to parents, I tell this to the teachers and therapists who are so like, well, what should I do when? And my answer is, you won't know until you get there. How will you know? And then the next question is, but are you present enough, and are you awake enough in the moment to listen to what the moment is trying to tell you? Because everything you need to facilitate a moment is in the moment. But where are you? You in the past? You in the future? Are you, this is mine, this is theirs? Are you trying to disconnect from? Or are you, let me just feel the moment. Let me experience what's happening in my body. Let me become aware of what's happening in my mind. Let me be deeply curious in this moment. Let me be present in the moment. What is needed now? Okay, maybe what's needed now is for me to reflect the emotion back. Oh, wow, this is so overwhelming right now. Or maybe what the moment is asking for is just go give the kid a hug. Or maybe what the moment is asking for is quiet. Don't say anything. Just stop, right? Just hold some stillness because something is trying to settle. Or maybe what emerges in the moment is move your body. This is so intense, right? So it's an invitation to take a deeper breath or feel your feet on the ground or get a sip of water. Again, to just stay connected. And to me, that is emotional intelligence.
Mm-hmm.
It's the can we become aware when we've disconnected from ourselves and we've moved away from the present moment, and how quickly do we come back? That's literally how I define emotional intelligence.
Mm-hmm.
And then when I'm in the moment, what's my range? And what I mean by that, what experiences within me can I sit with, and which ones do I feel the need to run away from?
And I also think that something that is also very important, I see it also as a skill.
Mm-hmm.
So it's not just the skill to be able to be present in the moment and to listen to what the moment is asking of you,
Mm-hmm.
but of the accumulated experiences that you have, the level of tools and the different, I would call them techniques, to be able
Yeah.
to apply in that specific moment. And I see it a lot in specifically like martial arts, and I can see it in jiu-jitsu, for
Yeah.
example. Like there are so many moments in jiu-jitsu where you are throwing everything out the window, and it's just make sure you're still breathing.
Yes.
And make sure that you're here right now connecting to that
Yes.
person's body.
Exactly.
And that person's body, and you're reading their nervous system. You're breathing into that experience, and intuitively, it depends if you're a white belt, blue belt, brown, the amount of experience that you have being exposed to that, where the skills and techniques that you have accumulated through so much practice is going to tell you, oh, well, you can pivot your weight into this and direct your weight into here and grab his gi and throw him that way. Sometimes you don't know. You don't know what you can come up with. You don't know. You don't have the techniques. You don't have the experiences. And I think it's all about, for some people that are seeing this, they can be hearing this for the first time and be like, well, what techniques should I start learning to implement? One of them that you mentioned was the reflecting back, which also in tactical empathy, they call it labels.
Yep.
Which is reflecting back what seems to be happening in that moment and what seems to be feeling like that in that moment, which is another technique is breathing. So let's just, so that we can give some good tools to our audience, is like the first thing that you can do is connect back to your breath.
Yep.
Connect back to your range, like you called it, which is connecting to that feeling and giving yourself permission to experience the whole feeling of the experience, which is what people that go into the ice bath are ultimately practicing, giving themselves the permission to experience really coldness. And then bringing into it an awareness through your breath, and then labeling it and labeling it through naming it, right? So, wow, it seems like it feels overwhelming, or seems like there's a lot of information going on, or seems like this is something that's really hard. Bringing into awareness what a sensation feels like. I mean, I learned it with you.
And I would even say a place that I think a lot of people get nervous about is naming what's happening within themselves. So the piece that you're talking about, yes, and it's very vulnerable to say to someone, I'm feeling overwhelmed right now. Right? Or I just got scared. Or I'm feeling a little wobbly. That's very vulnerable to say to somebody.
Yeah.
Or, as you're talking, I'm noticing my heart is like racing like so fast. Or, as you're talking, like whatever it may be. So I think that's a place of practice. Can we, as we're seeing someone else, can we also allow ourselves to be seen? Because here's the magic. If we're present, we're attuned, and we name what's happening in us, there's a high probability you're also naming what's happening in them.
Mm-hmm.
And so there's this beautiful sort of mirroring that can go on. And when we name, so if I say, wow, that's a lot. Like I'm trying to track this and I'm struggling to track, or whatever it may be. Let's just say that the client, that's what's going on for them, or the kid, you just gave them permission
To feel that.
to feel it. You just gave them permission to go towards that experience in themselves, which is what they were avoiding, which is why they set you up, because they needed it mirrored back, because they're having a hard time integrating it.
Yeah.
And so the more...
Because you can't, and this is just to make more emphasis, because it could be from information overload for our clients.
Yeah.
Because it's a bit information overload for me. Because there is a setup, and this is going on all the time,
Yeah.
where through our nervous system,
Yeah.
we are, and I think David R. Hawkins
Okay.
from the book Letting Go talks about this also, of how what we are repressing, we are setting other people up to feel.
Yeah.
And we're using them as emotional triggers for us to be able to ventilate our own repressed emotions. So if we're feeling insufficient, we're going to be constantly criticizing someone, telling them that they're insufficient, so that they can feel what it feels like to be us.
Yep.
So that when we communicate through our nervous systems, that person can exemplify how to regulate that feeling. And if that person has the emotional intelligence, the empathy, and the tools, with some synergetic play therapy, for example, and that person can say, wow, I'm feeling really insufficient right now, right? The person that set that guy up is going to now give themselves the permission to feel that too. And that's going to regulate their nervous system and integrate their own sufficiency and completely reconfigure the relationship they're having with themselves.
Yep. Let me throw a little curveball in here,
Mm-hmm.
because I imagine some people might practice this. It is possible that when someone authentically names an experience, that it freaks the other person out.
Yeah.
And it freaks them out because you just put the mirror up like this. And to the degree that that the person, it's like, wow, that was really intense that got mirrored back. Now, I'm not talking about that this is happening on a conscious level. So someone might say, I said something and it seemed like it activated them more. That's okay. You breathe. It's their journey as they then get wobbly with how do I move towards the mirror that just got held up. One of the biggest myths about
but
regulation.
that's also a risk, because then you get antagonized, or then you get attacked. And then, because it's happened to me all the time, especially when flirting. I'm just being honest, and all of a sudden the honesty is like way too much.
Yes.
And it's not even like using imprudent words. It's not even about like, I'm just like, hey, potential, maybe I can't, like there's this one time I told this girl, it's like, I don't think that I can offer you what you're looking for. Boom, just a complete explosion. It's happened to me at the club sometimes, where I tell a girl, hey, I'm with my friends right now. Some subtle way of rejection. And it was just boom. It was just.
And that's okay. I think, so let's even back the conversation up. I think a lot of times when people are talking about emotional intelligence, there's a fantasy that I'm going to learn a skill, or I'm going to understand the emotional world enough where I don't have to experience any pain.
Yeah.
Right? Or I'm going to master the feeling good.
Yes.
Right? Because I'm emotionally intelligent.
Positive thinking.
But that's not what emotional intelligence is about. Emotional intelligence is about being with, period. Being with all of it. being with the intensity here, the intensity here, the intensity here. It's the courage to keep showing up time and time again.
It's the courage to keep showing up time and time again. It's the ability to hold space for yourself in order for you to regulate everything that's going on within yourself. And it's also the ability to preserve a certain mental equanimity within this whole experience, and be able to reason objectively.
Let's bring in the Demartini Method as our piece here. So we're talking about the body.
Mm-hmm.
So we're talking about the body mostly with kids, because their prefrontal cortex isn't online. They're not into abstract thinking yet. Not to say that some kids aren't, but for most kids in their development, they're not there. However, the adult is.
Right.
And so this is where the Demartini Method, for me, talk about really shifting
the mind
and the paradigm. When I think about self-mastery, regulation of the body is not enough.
It's not.
Regulation of the mind, particularly the perceptions in the mind, is also important. I'd also go the other way. Regulation of the mind is not enough.
Exactly.
You also have to be able to regulate the body, because the perceptions and thoughts influence the body. You can also have
nervous system,
the
fascia,
body
everything.
Influences the mind. They go hand in hand, so you really have two beautiful entry points.
Yep.
Which is why you also
and
don't always
neurons
have to say something. Someone can be having a hard time, and me even just taking a deep breath.
And you have like more than 500 million neurons in your gut. And there's also neurons.
There's so much.
There's just so much information.
Yes.
So your gut and your mind
Yeah.
and your brain.
So for me, part of my ability to work with being present, which let's also have a human moment. People go in and out of presence. That's another big fantasy. Oh, I'm going to get really emotionally intelligent. I'm going to be present all the time. No, you're not. You're not going to be calm all the time, because that's not the point. You're not going to be happy all the time, because that's not the point. The point is that you're going to go in and out of experiences. That's the point.
And you're going to be able to dance through them.
Right, more mindfully. That's right. That's the whole point. And so what the work of John Demartini provided me, which was so beautiful, was context. Context for my mind. The ability to have a deeper understanding of why am I having the perceptions that I'm having, and what I can do with those to then influence my body. Mm-hmm. So just because I'm with somebody and I'm feeling something or I'm experiencing something, doesn't mean I'm not having judgments about it.
Exactly.
It is my work to then go work through the judgments about it.
Exactly.
Because all the way back to the beginning of our conversation, because I'm filtering it all through my freaking history.
And
so I am responsible for my history.
Yeah, and your history is an accumulation of judgments.
Exactly. So the more I get to work with my history, the more I get to hold in the present. I'll say that again, because I think that's big, right? The more I get to work in my history, the more I integrate my history, the more I get to hold here. Because there's different levels of activation, different levels of charge.
Yeah.
But the combination of therapies, protocols, Demartini Method, we'll put it in a protocol.
Yeah.
To learn how to regulate the mind.
Shift perceptions.
Shift perception. I would also say certain cognitive behavioral interventions of just learning about also how to use the mind. Super helpful. Gestalt theories, Jungian theory, they all are helpful. Where I get nervous is when someone tells me I've studied one and that's all that I do. That's where I get nervous. And that would be my biggest sort of advice, which is that one is not enough, because not one thing can describe the experience of the human complexity, or can handle the experience of the human complexity. So if we're talking about skills, get range, go explore many therapies.
Exactly.
If you're a very mental person, go do somatic therapy.
Mm-hmm.
If you're a very emotional feeling person, go do some cognitive stuff. Mm-hmm. If you are, more sort of metaphor, symbolism, cool, go explore some cool stuff there, but experience many things. Experience many different practices.
And experience especially the things you don't resonate with.
Exactly.
Because you're only as strong as your weakest link.
Exactly.
And you're only as aware as your blindest spot.
Exactly. Exactly. So go in the direction of where you are most uncomfortable.
Yeah. Yeah. And I think that we're gonna soon be wrapping it up. I want to talk just a little bit of this whole, everything that you had mentioned, synergetic play therapy, and you mentioned about the Demartini Method. We met each other at the Demartini Institute when I was 14. Tell me a little bit about how understanding Demartini, understanding their Demartini Method, and going deep into perceptions, going deep into moments, going deep into judgments, going deep into fantasies and nightmares and philias and phobias and labels, labeling, exaggerations and minimizations. And I think I don't know if we have even time to be talking about the great discovery, which is the synchronicity of opposites, which is a whole, it's almost close to like a DMT ayahuasca trip without the DMT or ayahuasca. It's just that's a whole nother mental space there. But how has the Demartini Institute, the Demartini Method, everything when we met up until how would that participate in your evolution? Because I do think that integration with all of the
what
behavioral.
What year was that when you were 14?
I mean, I'm 27 right now, so it's 13 years ago.
Okay, so 13 years ago. So that is probably
2023. That was 2010.
So
No, 2000.
I put synergetic play therapy out there in 2008. So that was shortly after. So the Demartini Method has given me extraordinary permission to be myself. It has given me a tool to work through the different perceived challenges that have emerged on my journey. It has given me permission to challenge norms, to challenge constructs, to be more intuitive, listening here versus listening out there.
Yeah.
It's also accelerated my work with my clients.
Yep.
So even just the application of the Demartini Method as a tool, what I've been able to do with clients in such a short period of time would have normally taken me years to do before I had discovered the method.
Yep.
So I do believe that it is the fastest, most integrative trauma protocol on the planet. And I say trauma protocol, and I don't mean that it's only used for traumas, but I like to say it that way because people tend to use trauma as the bar for if something works. So when I say trauma protocol, I'm saying trauma protocol and also everything else that's below a trauma protocol. But it's it is the most succinct, integrative methodology that I have yet to come across in my work, and I'm incredibly grateful for what it's done for me and for my clients.
Yeah, I'm incredibly grateful for it too, and it's something that, I mean, the Mexican-speaking audience, I know that there's a lot, everyone is having to tune in English. There's so little in the Hispanic-speaking people that have the access to this. I mean, just synergetic play therapy within itself. Like, there's just so little, and there's this whole stigma that you're broken if you go to therapy. You're broken if you use these tools. You're broken if you're into emotional intelligence. But I see it everywhere. I see friends breaking up with everybody. I see girls when they open up and talk about their feelings. I see everybody they're going through emotions, and we're all going through emotions, and it's completely, you were going to say?
Well, let's just normalize this.
It's normalized.
So we all have a psychology. We all have something going on inside of our psyche. Therapy, and let me say this way, most of us aren't taught what to do with it. Most of us don't know what to do with this
Emotional content.
Exactly. That's a part of every single human being that's on the planet. So for me, therapy isn't this thing that you do sometimes when. To me, therapy is just as important as going to the dentist. It's just as important as going to the doctor. It's just as important as, it's just, it's something that you do because it's a part of It's not an exception.
No, I'll even take it a step further, like, because I see it a lot from an athletic point of view. So you don't go to physical rehab just because you want to make your knee work better. Once you go to physical rehab and your knee works well, yeah, you can still become an athlete. You can still start using those stretch bands, start using those same rehabilitation exercises to get stronger, to jump higher, to jump faster.
Exactly.
It's not only about rehab. It's not only about therapy.
Yep.
It's also about high performance. It's not about just getting out of the rut. It's also about becoming an excelling individual that has a competitive advantage and actually positioning yourself as a individual of high value. The ability that I've had to close sales, the ability that I had to have amazing relationships, the ability that I've had knowing how to regulate your nervous system when having sex. That could solve so much premature ejaculation, like big time, right? When we're talking about having the ability to relate with your spouse, with your partner, and with your family, because that's where you really get tested, right?
I think we could say, learn how to regulate your body and learn how to regulate your mind.
Learn how to regulate your perceptions.
Exactly. Learn how to regulate your perception.
Your
Learn how to
judgments.
regulate your body. Those are two really important. If we're talking about self-mastery, those are two incredibly important components. I'm going to say I hope, but I don't ever see myself not. The last week of my life, I hope I've participated in some kind of a mind-expanding, self-reflective, either therapy session, or I read a book, or I listened to a podcast, or I went and I got a conscious sort of massage or body work or whatever it is. Like, I hope I'm doing that up to the moment I take my last breath.
Yeah. Yeah. For me, it's just it's part of the everyday life, you know. And I invite more people through. I hope that this podcast invites more people to be able to understand that it's not because you're broken.
No.
You're not broken.
You're not broken.
You're not broken.
You're not broken.
You simply haven't been exposed to tools that show you what you can do with the magnificence of your body, with the magnificence of your feelings, with the magnificence of your perceptions, and with the magnificence of your mind. And you're just on top of a gold mine, and that pain, if you're going through pain, is just holding you accountable to reach inside that gold and learn how to do something about it. Learn how to do something with it. Learn how to do something with that gold. And so I think that that's all the time we have right now. But Lisa Terni Dion, everybody.
Thanks, Sebastian.
Last but not least, I would love to tell a little bit, everybody, your stuff. Follow Lisa Terni Dion at her Instagram is Synergetic Play Therapy. Is there a specific way that they can get in contact with you or learn more about what you offer and what you do, or be up to date on your adventures?
Sure. So synergeticplaytherapy.com is the institute and all of our offerings there. Synergeticeducation.com, which is all of this in schools. And then lisa-dion.com is my website. And then
Great.
I've got my book, Aggression in Play Therapy, and I have my podcast, which is Lessons in the Playroom.
Lessons in the Playroom, everybody. And if you guys want to follow me for more, you can see my Spanish-speaking Instagram channel, Sebastian Landa Z. You can also see my English-speaking channel on IG. I rarely use it because we're still growing and I have to pay more attention to my Spanish-speaking audiences. I am _the Dancing Dragon. And yeah, you can look us up on dragonconsultations.com, and you can see all our videos on YouTube, Dragon Consultations MX. And this is our first of many podcasts that we're going to be sharing some really insightful knowledge and bringing you guys some incredible tools so that you can regulate your life and direct it with greater certainty, gratitude, simplicity, presence, and unconditional love. So
Awesome.